Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Next week is Vaccine Week on the podcast. Co-hosts Josh Sharfstein and Stephanie Desmond will be bringing great interviews to our listeners, including the latest on the science of vaccines, how distribution is going, why some people are hesitant to be vaccinated, and critical ethical questions. You won't want to miss it. Today, Stephanie Desmond catches up with our mental health expert, Dr. Laura Murray. They talk about how to face the stressors that the new year has already brought and how to best push through what we hope will be the final stretch of the COVID pandemic. Let's listen. Laura Murray, thanks so much for joining me.
Great to be back with you, Stephanie. Happy New Year.
Happy New Year to you. I sort of wanted to start there.
Oh, no.
So, I think that when the new year comes, especially after a year that was as horrible as 2020, part of us has this whole wishful thinking that, 2021 is going to be great. Now, of course, we all woke up and it has certainly not been great in terms of the vaccine and other elements. So how are we going to push through?
It's definitely a question everyone's asking. And I think with this, talking about pandemic burnout or just the mental fatigue we have, we're all ready for a break. And I think, the new year, it was an opportunity for all of us to say, oh, the break is coming, there's going to be a big turn. And of course, in the change of a 24-hour period, that hasn't, and of course wouldn't just happen. I think as far as talking to our listeners, let's look for a few signs, right? So I think if you're feeling like you're mentally fatigued, if you're just burnt out, if you're just saying, things have to change and they're just not, look for signs of where that's coming from and how bad it is. So for example, signs might be you're less efficient, or something we're seeing a lot is having less compassion or patience with others. If you see that as a difference, if you're procrastinating, if you've gotten maybe into some good habits and you're doing that less, or maybe you're not doing those habits anymore, such as sleep and exercise, things like that. Those are all signs that really you're getting a little tired. And so one of the most helpful things for that is to try not to focus so much on the what ifs, right? Like we wanted this vaccine, we wanted it out, we want it now, and it's not happening fast enough. Those are all things we can sort of spin on. Or one of the things we talk a lot about is catastrophizing, right? What if I have to stay in my bedroom for another 6 or 12 months? Or what if we go on lockdown again? Those are catastrophizing thoughts that really just create a cycle of fretting and worrying and create mental exhaustion. And so one of the things that we can do is focus a little bit more on what we can control. And so that's the here and now, right? So that might be just this afternoon. What am I going to tackle? What can I actually control this afternoon? And trying to keep pulling yourself back that way to get out of that cycle of fretting and worrying and different thoughts.
Mm-hmm. But you say that as it's easy or something. I mean, because I know, for example, I live in Maryland and the governor said that proudly that 30% of the population will be vaccinated by May. Well, May is 4 months from now. By then, I will have been in my bedroom for 14 months.
Oh,
and that's only 30% of people being vaccinated. So I can't control that.
Yes, exactly. One of the most helpful things, I know we've talked about it a few times before, Stephanie, is writing these things down, right? What can I control and what can I not? And the things that I can't control, but yet I'm frustrated or angry about are things like this. I'm angry about this statement, or I'm frustrated with this statement, or I'm disappointed with how the vaccines are going. Write those down, get them out. It's really important to still give ourselves space to have those. Those aren't wrong thoughts or wrong emotions. And we definitely don't want to stuff them. And I think writing or talking about them really helps us just acknowledge them. But then I think the step a lot of us miss is having that second column of, okay, what do I have control of? What can I do? What do I need to keep doing? Where do I need encouragement to keep going the distance, to keep doing things in a good way, or keep staying inside if I need to?
Mm-hmm. You were saying to me recently that anger is not necessarily a negative emotion. Talk to me about that.
Yeah, with everything going on, even in the new year, there's just a lot of emotions. And we're seeing in particular a lot of anger, also anxiety and discontent and things. But anger is really talked about as a negative emotion, but it can also be a very positive emotion. For example, anger often leads us to do something about something or speak up about something. However, it's often left unchecked, or we don't get into awareness of where it's coming from. And then it can lead to aggressive behavior. And so, as we're seeing just a lot of anger brew about everything, we're talking a lot about different cognitive behavioral interventions. And cognitive behavioral is sort of a fancy way of just talking about how the way that we think, feel, and act are all very connected. So if you want to shift your emotional state or the intensity, right? So if we want to shift out of anger or reduce the intensity of anger, we all have the power to change what we're thinking or what we're doing. And that can really sort of jiggle that anger out of a negative space. So just a couple things to do, because as you know, I always talk about these things. And then as you say, Stephanie, that sounds easy, but it's not easy at all. Identify triggers, right? So if you find yourself angry about things, what is it? And it's different things for different people. Writing that down or talking about that, making sure you know what triggers you. If you know what triggers you, limit it. I know a lot of people who are triggered by Twitter. Don't be on Twitter, or have set times that you're on Twitter, but then make sure you plan for some sort of relaxation or deep breathing after to get you out of that emotional state. So things like that, understanding what's behind that anger. We always talk about managing thoughts, right? So instead of thinking over and over, 2021 is already terrible, nothing's going to improve, this vaccination stuff is never going to, get to the point where it needs to be, try focusing on something more helpful. We have a vaccine. So it's really back to that ruminating, doesn't always help. The other thing I'll just say about anger is to really think about what's underneath it. Anger is often a surface level emotion that we talk about without realizing some of the deeper feelings that may be harder for us to acknowledge, like embarrassment or fear or sadness. And I've really seen people get to a different ability, a better ability to control their anger when they really understand all those feelings that are beneath it.
Mm-hmm. One thing that sort of I've been talking about with my friends and colleagues is sort of this whole idea, like we're in the home stretch. We don't know how long the home stretch is going to be, but there's so much more. In many ways, people are like, let's not, don't get sick now because, we are almost there. And then of course, so many more people are getting sick. So I guess my question there is sort of, maybe it's just about people who are doing the right things. And since also at the same time we've had record numbers of deaths for days now. So even though I know like I'm doing the right thing, people are still dying and the hospitals are full and we're not allowed to go anywhere. So I'm not even sure what the question is there, Laura.
I think what you're tapping into, though, is a very real sentiment. It's interesting. I've heard and I've read a lot lately about people talking about war times in relation to this and how there's sort of a common quote or citation used about no one wants to die in the last days of the war, right? You don't want to die at those last times. And that's sort of what people are feeling. Can I just hang on? And I think it's back to what can you control and what you can't. And really watching how much we circle around thoughts like that. Like, there's a record number of deaths. People are dying. The vaccination isn't coming. Now we're learning that there's a new strain perhaps. So there's a lot of things going on that we don't know about that are worrisome. But again, trying to contain those into a what if column and trying not to get into that catastrophizing phase and then moving it over to what can I control? And I would just say, allowing each of us some gratitude and some praise for doing the things we have been doing. One of the things we've been trying to get people just to do in society to each other is praise behaviors. When we as humans have our behavior praised, we do it again. It's just a very common phenomenon, right? If I say, I like the shirt you're wearing, Stephanie, you're going to wear it again. That's how it works. But it's interesting because in society, we haven't been saying things like, wow, Stephanie, it is so great that you stayed in your bedroom that long. I am so proud of you. That's amazing. And I think that would really go a long way, right? Because it is hard and exhausting and tiring. So, maybe one movement is to sort of start saying like, wow, thank you for wearing your mask. I really appreciate that. That's very kind to me, because I think it could start a trend of people increasing protective behaviors.
One thing, I wonder if those of us who are getting tired, maybe a variation on sort of New Year's resolutions. I will say that one thing I have done to keep my sanity is walk. I walk every single day, at least 10,000 steps.
That's amazing.
And that's how I sort of try to keep my sanity. And I guess there are things that people, maybe if they haven't been exercising or they haven't been eating right, maybe this is a good time for people to sort of start trying to find healthy behaviors that can make them feel better.
Absolutely. Absolutely. Using New Year's resolutions to start thinking about other people more, having more compassion, having more grace with ourselves, increasing that exercise or getting better sleep. Those are all great ways to improve ourselves.
One thing that I did want to ask you about is stigma. So, I think that there are people, for example, a friend of mine got COVID and has no idea where it came from. She felt like she was doing all the right things and she got sick. And now she's very embarrassed about the fact that she's sick. Why is there still stigma associated with this?
Yeah, this has been such an interesting question and very important through a pandemic, right? Because we're asking people to disclose if they are positive to a large number of people and sort of say you may have been in contact, and that can be hard to do. So speaking as a psychologist, so human nature is to seek meaning and answer the question why. And so if I have COVID and I've been staying at home, it's a normal reaction to why. Like, I need to understand why and how I got this and what I did. And you can start going into all sorts of thought patterns of what did I do and look through all of that. And I think that's where a lot of stigma from others come too, is that it's just a normal reaction. If you called me and said, look, we were in contact together, I just got tested and I do have COVID, I just wanted to let you know, human nature says, I'm going to say, well, why? Like, what did you do? Where were you? That's just human nature. And so I think it goes both ways. One is understanding that that's a human nature really allows us to not blame the person who's asking about the why, but just understand that's a normal thing for us, right? If we were asked to give a portion of our salary or our income to something, we would want to know why, and that would dictate our feelings towards it, right? If someone makes a decision within an organization, we want to know why, and that's how we get buy-in. That's how we sort of emotionally get behind something. So when we don't understand the why, it's frustrating, it's disempowering. So a lot of these folks that are getting COVID without feeling like they did anything can be very, very frustrating. So I think understanding that as a community, as a human condition, we just want to understand why is a really helpful place to start. And then try to have empathy, again, going back to just praising behaviors that are COVID protective. So for example, if someone calls me and says, look, I just got tested positive for COVID-19 and we were in contact, I would say, thank you so much for letting me know. That is amazing. That kind of praise is really important, rather than, even if we're feeling angry or nervous or fearful ourselves, taking a deep breath and being able to say that to that person.
Mm-hmm. Well, Laura Murray, as always, it's a pleasure to talk to you.
Thanks so much, Stephanie.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.